All right, hey everybody, welcome back to the channel. For those of you who are new here, my name's Rahat and I'm an incoming first year medical student at James Cook University over in Australia. And on this channel, we talk about all things related to lifestyle, medicine. I try and give you guys some educational content as well along the way, including stuff like this video, where I got to interview one of my mentors and a great pediatric surgeon and adult general surgeon from Las Vegas, Dr. Erik Pearson. This is probably one of the longest videos I've made because at first it was over about an hour of conversation, and I cut everything down for you guys and tried to give you kind of as much exposure to the field of pediatric surgery, which, if you know me personally or if you've kind of seen across this channel, is one of the things that I want to do with my career down the line. Since it's a long one, I've tried to link some timestamps down below in the description, and yeah, so here we go. And before we begin, I'd just like to say thank you guys for watching and taking the time. And obviously I know it's a long one, but hey, if you're into this type of content, or you just want to follow me through my journey through medical school, which means eventually getting there, just because of COVID border closures, I had to defer. But then I got an email saying that I might be able to defer back into this year if the border opens up in March, so it's a mess right now. But yeah, if you're into this kind of stuff and you like the educational content, or you just want to stick around, then feel free to subscribe to the channel or follow me on Instagram. I have my socials linked below as well, and then we'll go from there. All right, here's the video. So Dr. Pearson, welcome. Thank you for being here.
Hey, thanks for having me.
Yeah, no problem. So before we start, I guess, do you want to tell us a bit about yourself and kind of what you do and what you're doing with like Citizen Surgeon and all those things?
Yeah, man. My name's Erik Pearson. I'm a pediatric surgeon. I live in Las Vegas here, and busy clinical practice, but I also get to teach surgical residents. So we have basically 2 general surgery programs that I work with. And when I'm not doing, and I'm also involved, I got a bunch of quality stuff in the hospital that I'm involved with. And then outside of that, I built this platform, and it's just kind of in its evolution, but it's called Citizen Surgeon, and it's kind of like my educational outlet for teaching. And it came about a few years ago. I started kind of blogging about things that I was dealing with either as a student or as a resident or fellow. And then that kind of transitioned into, when I give talks to the residents, I sometimes think like, gosh, I put a bunch of time into this talk, hours. Like when we give talks, I'm sure when you guys give talks, you put hours into creating that discussion. And, sometimes you're giving it to a room with only a couple of people in it, and it can be a little disappointing. So I thought, well, how do I scale that? And so put together a little YouTube channel, and right now I have only a dozen or so videos on there, but I try to get deep into topics in general surgery, and I got a bunch of the basics covered right now. So the metabolic response to injury, got surgical nutrition on there, working on shock right now. So it's been a lot of fun, and I've gotten some good feedback on it. And so you can get to the videos on YouTube, you can get to the videos on the website, citizensurgeon.com. So yeah, it's kind of right now my educational outlet to reach out to medical students, to surgical residents, to try to form a community of people. And that's it, man. I got a little newsletter that comes out every Saturday. You can sign up for on the website, called the Saturday 6. It's like the 6 things that, I'm thinking about or pondering that week, or things that kind of, I think would add value if you were a student or a resident, or even if you're a surgeon out there sitting for your research or whatever. So yeah, man, check it out. And if your audience wants to check it out, and wherever, reach out to me. I'm totally available. Try to answer anything I can.
Yeah, no, I remember coming across your videos because there's almost nothing online about like pediatric surgery, just because I'm guessing like for patient confidentiality sake, that you also just talk about topics in a general way, and it just really helps get an idea of what it's actually like versus what you might think it's like from TV, books, or whatever it is. So I found it pretty helpful myself. I've got a few questions from just people, and like as well as myself.
Fire away.
I guess we could start with, so why surgery? Why pediatric surgery? Like why general surgery? Like why like surgery as a whole within medicine, and then also why your specialty within surgery?
That's a big question. Big question. All right. And, and I can answer for me, and I think that everybody's going to be a little bit different, of course. For me, I knew that I wanted to do medicine, kind of throughout undergraduate and especially towards the end. And so after I got into medical school, and I was trying to decide what specialties attracted me most. And you kind of have to like reach deep into your personality and find out what type of thinker are you, what type of things do you like to accomplish. And so for me, I enjoyed seeing fix to problems immediately and having that immediate feedback. And I also liked anatomy, and I liked the energy of the operating room. And when I did my rotations and I hung out with the general surgeons, they were sort of my tribe. They were kind of my people. They're the people that I really enjoyed talking to the most and that I felt the most comfortable around. And I enjoyed kind of their passion, their perseverance, their grittiness. Always seemed like they were the earliest to the hospital and the latest to leave. And I really clung to that when I was a medical student. So, I took my anatomy course and I loved anatomy. My buddy, Dr. Gary Bass and he's a trauma surgeon. He's at Penn right now. We would late hours in that anatomy dissection lab, and I just totally loved it. So I think combining that, maybe it's a need, but that desire to want to see an immediate fix to things. I enjoyed using my hands, and then my love of anatomy kind of drew me to surgery. But throughout medical school, I still looked at some of those procedural medicine specialties. So I really liked gastroenterology. So I thought, well, maybe GI would be something, because I was a little bit worried. Can I be a surgeon but still have a balanced life, still do the things that I like to do, get married, have a great relationship, have kids, can you do all that as a surgeon? And it took a lot of conversations with people like, yeah, hey, you can lead a good balanced life and you can have everything you want and you can do surgery. And so once I got over that threshold and I did some away rotations, then I knew that, yeah, I can do this and I can have everything I want. And so surgery became like a reasonable option. And so after being on the rotations and finding out that, yeah, I like surgery and it was also something I was good at, I matched to the University of Utah, and I ended up doing my general surgery training there. And then, picking pediatric surgery, excuse me, pediatric surgery is certainly a calling. And, for me, when I rotated on pediatric surgery, I found the absolute best mentors at Primary Children's in Salt Lake. And, they took me under their wing and showed me that pediatric surgery is this amazing specialty with this spectrum of not only ages, so from fetus and neonate all the way up to basically young adults and after adults with congenital problems. But within that, kids have such an amazing energy. And to me, there's really no greater responsibility and privilege than taking care of someone's child. And, when you're rotating on the pediatric surgery service and you're working with these surgeons that are taking a really sick kid and making them better, fixing a difficult problem, that really to me was the pinnacle. And so early on in my surgical training, I knew that that's what I wanted to do. And so I just asked my mentors, hey, what do I need to do? What do I need to accomplish to get there? And they showed me the way. So that's kind of probably a longer answer than you wanted.
I think that's super detailed. So I think it's really helpful as well for anyone like looking down into that route to get some insight behind, like, because you're an attending now essentially, and that's a lot of like breadth and experience that you've had within the field. So obviously hearing that from someone might help someone else who's looking into it down the line.
Absolutely. I think that no matter where you're at, the common theme for me was growing my network and putting myself into different experiences. So you can't really think that you want to do something until you've spent time with the people doing it. Um, I hear a lot of young people, I want to be a cardiac surgeon, or I want to be a trauma surgeon. Well, spend some time with a cardiac surgeon or a trauma surgeon. And when I was an undergrad, I volunteered at Harborview. That's a trauma hospital. I volunteered in the ER at Harborview in Seattle. I volunteered at Seattle Children's. I did some volunteer work in, science labs and things, and tried to do as many experiences as I could to find out where do I gel. And, I really enjoyed that experience in the Children's Hospital. I really did enjoy that experience in trauma. And so you're constantly putting yourself out there. And I didn't enjoy the experiences as much on some of the medicine rotations. And that wasn't like a once-off decision as a third-year medical student. That was, years and years of either volunteer experiences or, before or after hours in medical school and undergraduate, kind of hanging out with people and finding out like, oh yeah, this one's for me. And I think if you have a depth of experience that can help you make that decision, then when you make the decision, not only is it a lot easier, but years down the line, you're going to come back to that why. And that why is going to be really important. And when you're missing, your daughter's birthday or your son's soccer match, you'll come back to that why. And if you made the right decision based on lots of experience, then it becomes easier. It becomes much easier.
And so obviously you mentioned your family and just like work-life balance a lot, or even like today and then before when we've talked as well.
Yeah.
So a lot of people were wondering, like, how do you as a surgeon try to maintain that work-life balance and have that family life and all of those other things?
Mm-hmm. So it's about being intentional, okay? And if you don't plan and if you don't have a calendar, then you won't be able to fit anything in. And so I'm very intentional about my day. So when it comes to personal time, I wake up at 4:30. I have this kind of savers algorithm I go through, and that's my personal time. So the savers I got from Hal Elrod's Miracle Morning, it's silence, affirmations, visualization, exercise, reading, scribing. So doing some journaling every day. And so that's my personal time. That can be anywhere from 30 minutes to an hour. And then when it comes to work, I go to work, I work hard. When I'm at work, I try not to be sitting around, and I get everything done that I can, whether it's research or writing my notes, operating, obviously, whatever quality projects. And then when I'm home, I'm very intentional about being home. When the day is done, I'm done. And, that doesn't mean there won't be an additional phone call or two or something that comes up I have to take care of. But when I'm at home, I spend that time with my kids. And if there's additional work to be done, I do all that after everybody goes to sleep, because I consider that, my time, again, after everybody's asleep. And so if I didn't get work done that day, like my charting or notes or something, then I go back and I'll do that after everyone's asleep. But I'm very intentional about when I'm home, I get that time's for my wife and my kids. And, also my wife and I, we put in the calendar date nights every week. We're very intentional about, getting a babysitter and getting that quality time together, because we have 3 kids and we got a new dog, and it's a high energy house. Right. And so if I came home and I just got on my laptop and did all my charting while my kids were running around, I don't think that's very quality time. And it's all possible, but you just have to plan and be intentional about it. And I think that if you start now, when you consider your life busy, right? Maybe you don't have a family, or maybe you do, but life is always busier, and you're just going to keep fitting more things into that life. And so if you can start planning and getting your calendar now, it's going to be a lot easier when life gets fuller.
Like obviously with pediatric, you're dealing with, young children, like you said.
Hmm.
How do you mentally prepare yourself for some of the more like actual like life-saving procedures rather than the more routine stuff?
Hmm. Yeah, the most important thing really is to get good training. Okay. Um, Not all training is the same. Um, you know, I guess every training program has to have a particular threshold, but you want to put yourself in a position where either for medical school or for residency training, that you're going to get those exposures. You're going to work with those surgeons that are going to teach you, you know, how to perform in those emergencies. And if you get more reps of doing that as a resident and you find yourself in a training program where you have a lot of responsibility and you have a lot of accountability, then when you become an attending, you know, those experiences you will not be seeing for the first time. And that's really important. All right. The other thing is, it's important to think about how you can relate the day-to-day operations to those emergencies. Like, so for instance, yesterday I was taking a resident through a laparoscopic appendectomy. Okay, common operation. We do it several hundred times a year. And, you know, I wanted to give him the idea that, you know, an appendectomy is a really good operation because it combines a bunch of different skills that you can use in more complex operations, right? And I always consider an operation like a story. It has a beginning, a middle, and an end. It's not steps. There aren't steps to an operation. You know, the beginning is the setup, how you're going to position the patient, how are you going to put your ports, where is the target, how do you triangulate to that target, what's your plan A and plan B, you know, and then the middle of the operation, the middle of the story is, you know, accomplishing the goal. You know, for an appendectomy, sometimes it's as easy as finding the appendix, making a mesenteric window, dividing the base, taking the mesentery. Sometimes it's stuck or obliterated, or sometimes it's all falling apart. And so if you've memorized, now we go to step 4, and step 4 is impossible, what are you going to do? And so taking it back to your question, what do you do in emergencies or the mundane everyday? If you pay attention to the small details of the everyday, like, you know, for instance, putting in a chest tube after you've done some thorax operation, right? And you just focus on, oh, what's this feeling of getting my clamp into the chest? Then when you have to do that and somebody's dying in front of you, you've already done that in a very controlled environment. And now you're just doing it with a little bit more speed, precision, and intention, right? And so if you can think about how to apply those from every day to the emergency, then that's very helpful. And then there's another component is, you know, how do you kind of mentally, emotionally prepare yourself for those emergencies? And a lot of that comes down to training, you know, educational preparation, being able to go through all the steps. So for example, you know, when I was on October 1 in Las Vegas, that was the mass shooting, and you know, a shooter rained terror down into thousands of people at a concert. And so I was one of the surgeons that responded to that. And so going down with my partner to the hospital, you know, in my head, I was rehearsing and reviewing all of my vascular exposures that I learned in training. And, you know, I knew that I was going to go into a very emotionally intense environment, but it was going to come down to controlling that environment. And I went to a residency program and a fellowship program where, you know, I had very intense experiences every day, whether it was controlling a trauma bay or putting a baby on ECMO, extracorporeal membrane oxygenation. And those are in emotionally intense environments. And so when you get lots of reps doing that, when you're an attending and now you've done it hundreds or 1,000 times, you know, that experience isn't as intense as, for instance, you would perceive it because you just haven't had those reps. So That was a long answer to your question, but I think that it's really important that you choose a good training program where you're going to get those reps, and then you're present during your training, because every day is an opportunity to learn something. And you have to get, like, when I was a medical student, I tried to get out and hang out with the people that were going to be influential in my future. And so, for instance, I spent a lot of time with, some of the urologists. I just got in the operating room, so I could get those experiences. So, reach out, get the experiences, be present. So when you have an emergency and you're attending, maybe you have to get an emergency airway and a baby, you won't be going through that emotional experience that for the first time.
Mm-hmm. And so I guess, like, also continuing with the emotions and obviously exposure, how did you find it your first time in the OR? Like, when you were doing, I guess, like, your first case on your own, and the attending wasn't?
The guy was the attending. Yeah. It was, so my first case that I did as an attending was an appendectomy. All right. So it was nice. It was something that I, was very familiar with. So it's a good first case. But the interesting thing about it was, throughout my training, I had learned to use a particular set of trocars, or, maybe the Virus needle to insufflate the abdomen. And so when I was at this particular hospital, it was the first day, and I walk in, I'm like, oh, okay. So we have a little different stapler, or different trocars. And, the trocars that I was used to using didn't fit the stapler that I had. So, the first case, it was good that I got there early and could kind of sort through everything. But, the important thing is, if, like, that was kind of a little bit frustrating, because I was like, oh, I learned with these tools and now I have a new set of tools to use, but the operation's the same. And then the second case was totally fine because I knew exactly what tools I had. But, I think when you're stepping into a new environment, it's important that you look in your toolbox, you find out that what you might be using at this particular place is not the exact same as you used years before, right? And just to get comfortable with a new tool set in a new place. And so that was a little bit of a learning stone for me, but that case went great. Got the appendix out. Okay.
Sounds good. So speaking of toolboxes, someone actually did ask, they asked what your favorite surgical instrument was, and then what your most used surgical instrument was.
Okay. It's a great question. So I would say that favorite instrument is probably whenever I'm dissecting, I like to use like a small right angle. So it's like a clamp that has a right angle on it. And I think it's a great instrument, either that or a fine hemostat for dissecting. Okay, so if I'm doing a tracheoesophageal fistula dissection, I like to use, a fine right angle to get through those tissue planes. And then I would say, what's the most used instrument? I'd say the most used instrument is probably my needle driver. So I'll use like a set of riders and my needle driver. But I would say kind of the funnest instrument, that's not really a word. The most fun instrument to use is it's called a Just Right sealer, and it's a little 3mm sealing device. And so, like, there are different sealing devices out there that you use laparoscopically. This is a fun question. It makes me think of all these different things that I can use. So, like the Just Right sealer, it's a little 3mm sealing device that I'll use in like thoracoscopic TEFs or thoracoscopic lobectomies if I'm taking the lung out in a little baby with a CPAM or other congenital lung malformation. But then as an attending, so the learning never stops, right? So after I finished PEDS fellowship and I became an attending here, I was never trained on the robot, but we have a robot, a Da Vinci XI at the hospitals that I work at. And so I was like, wow, it'd be cool to go get robot training. And so I went and got trained on the robot, and so now I do some robotics, and that has been awesome, right? And so to learn how to use the robot and to see how I can use that as a tool to apply to different pediatric pathologies, I think that's been very exciting. So I look forward to my robot days, and it's a totally new skill set, right? And that technology is always advancing and developing. So that's been a lot of fun. So what's most common? Needle driver. What's one of my favorite open tools? Yeah, right, a little fine right angle. Then laparoscopically, I like using that sealer, and then the robot's been pretty sweet.
Okay, so robot, I just think is super interesting because
Yeah.
like the amount of precision that it has.
Mm-hmm.
It's just, I don't know, it's just kind of mind blowing that you can.
It's really what it gives you is it gives you a couple of things. So from a surgical point of view, we can be really precise laparoscopically. I can do any operation that I can do on the robot, I can do laparoscopically. And so what does the robot give you? Really, it gives you an extra degree of freedom. So in surgery, we talk about degrees of freedom. So, in, out, up, down, left, right. These are all, degrees of freedom when you're operating. Well, what the robot gives you is it gives you one extra degree, which is these wrist instruments, right? And so that allows you to maybe get around structures a little bit more delicately. It also gives you this stereoscopic vision. So when you get into the robot, you basically you almost feel like you're in the abdomen, or in the chest, which is kind of a cool feeling because it's like three-dimensional vision. And then 3, it gives you surgeon comfort. So instead of, being hot standing up in my gown and sterile, after I put in my ports and dock my instruments, I take everything off and I go sit at the console, and, I can be in my scrubs and my Birkenstocks, super comfy, right? So I think that the robot has a lot of advantages. It is precise. It is very precise. I think the thing that you lack when you're doing robotics is right now, at least the XI, it doesn't have tensile feedback. So you don't know how hard you're pulling on something. And the robot will pull, you can pull as hard as you want. Like you could rip bowel in half. You could rip the cystic duct off the common duct if you weren't careful. So you're using kind of your vision for that tactile feedback. So I think that's probably the next iteration of the robot will be giving, sensory feedback. But it's a cool instrument. If you're in the medical school, I'm sure if you talk to the Department of Surgery, you could at least get on the robot. There are all sorts of different games that you can play. Like you can sit on the robot, and it has all sorts of different games you can play to practice, how do you throw sutures? And so they have hoops you can pick up, or you have to push a needle through a hoop, and it's all right on there. It's like a video game.
That is really cool, actually.
Yeah.
And then, so back to surgery. So what's a typical day for you, and how do you kind of go about structuring your days when it comes to operating versus clinical days, I guess?
Yeah. So I'm in a private practice. I have 2 other partners, so there's 3 of us. So there's 3 of us. And so basically, today is my clinic day. So I have clinic all day today, and all round at the hospital that's near our clinic. And so for a given week, we have it pretty well organized, whether we're going to be in the operating room or the clinic. Sometimes we have to change it up. So for instance, yesterday, I was operating at 2 different hospitals. I had one hospital, I had one operation, and then I went to another hospital and I had to do a little baby operation, and then another, took out an appendix in another young kid that was sick. And so, some days I have to be pretty flexible, but usually I kind of know, is this going to be an operative day or a clinic day? And then basically the way that I structure it is I get up early, I do my sabers, I try to jump on either I have a Peloton, and so I try to jump on the Peloton, or I'll go for a run. And then, I have breakfast with the kids. And so that'll be happening here in the next half hour or so. And then, we have like a text between the partners, and we'll find out what came in overnight. So if I wasn't on call, then sometimes my partners will say, hey, we got a couple of things. Can anybody help clean these things up? And so I might go do another case to help out one of my partners or assist a partner. And then by that time, we'll decide who's rounding, and then I'll pop over to the hospital and either do my operations or finish my clinic. And then we'll always touch base in the afternoon about what's happening. And if there are any other patients to see or cases to do, assists to be organized. And then usually can finish up about 4 o'clock or so. And then after that, if I'm done around 3, then I try to pick up the kids. That doesn't happen too often, but it's pretty cool when it does. And if it's after 4, then I head home, and I have 2 7-year-olds and a 3-year-old, so we have lots of activities. And bedtime for the kids is usually about 7:30 or 8, and then we're asleep not too far after that.
Yeah, no, so you've definitely figured out the lifestyle aspect when it comes to medicine then.
I think so. I mean, part of it too is, it's about saying no, right? I mean, as you get further along, right? So one attending told me, and I thought this was great, that, life is just like a pie, okay? And you don't get to decide how big the pie is. You just get to decide how many pieces are in it, all right? And so when right now, maybe the only pieces in your pie might be personal life and school, right? But then that changes. So for instance, in my pie, I have personal health, I have family time, I have, my clinical practice, I have my administrative engagements, I have my educational engagements, I have whatever research I'm doing. I have this Citizen Surgeon platform that I'm trying to build. And so every time that you say yes to something, I started a quality improvement team at the hospital. And so we have projects on there. If, one of my partners asked me if I can help them with a paper, or another person at the hospital asked me if I can be on a committee, those are all slices that go into the pie. And so those all subtract from something, all right? So that usually subtracts from family time and personal time. And so there's this book, there's this author, Derek Silvers, who's read a few books, and he has this great kind of passage in one of his books where he talks about, he says, if when a project comes along, if it's not a hell yes, right? If it's not like, yeah, man, I totally want to do that, then it's a no, right? So it kind of has to pass the hell yes test to get a slice into my pie right now, right? So be excited about the things that you're getting involved with. And is that project worth, taking away something? If that's your personal health, whatever it is, and so it's harder to say no when you're a resident. Projects come along, you want to say yes, but also if you're going to say yes, get it done. Don't flake out on a project, because that's not good for you, and it's not good for the person that asked you to do it.
What's the secret to a life of happiness? So in your mind, what do you think is the secret?
Yeah, I think number one is to do something you find very fulfilling, right? That every day you look forward to it, to solving those problems. And I think that comes down to, we're talking about medicine right now. So, choosing that medical specialty and being true to yourself, right? So for me, I had to make a decision. Did I want to be more in an academic environment, or did I want to be in a hospital employed environment? But I ultimately chose private practice, right? Because I really enjoy the people I work with. I enjoy serving the community. And I wasn't as inspired with an academic environment when I was making this decision of where I wanted to be as a pediatric surgeon. And so I get to focus on my patients, I get to focus on my community and my hospitals. And so for me, I had to ask myself a lot of questions and find out, and sitting down with my wife and what we wanted for our family. And so we made a really good decision, right? And so every day I feel that I get to go to work, I get to work with kids, I get to alleviate suffering, I get to, relieve pain, I get to save lives some days. And so for me, that's very fulfilling. And so one is, do not be scared of the length of training if you're making a decision on what you want to do, right? I wouldn't decide on choosing one specialty over another because this specialty only requires 3 years of training, and to be a pediatric surgeon might be 9 or 10 years, right? And because you're going to have decades in that specialty. I'm 41 years old now. I have, been a surgeon for 3.5 years. I still probably have 20 more years working as a pediatric surgeon. And, was the length of training long and hard? It was. But now I'm at a point where I'm like, at least with my job, I'm living the dream every day. I'm doing exactly what I want to do. So put a lot of effort into finding that job that resonates with you. If you're in medical school and these are your rotations and you didn't get to rotate on ortho and you think that that's a specialty that you would really be interested in, find out how you can get there, right? I mean, medical school, it's medical school is an education for you, right? A lot of us, it's a great privilege, obviously, to get accepted and get into medical school. But once you get into medical school, then medical school is just a tool for you to use for your own education, for whatever you want to be. And so there is a responsibility of those schools to serve you, okay? And so you have to use your education to get where you want, or at least get you the experiences to make that. And then the second thing is, you have to have fun, right? Like, make life fun, and surround yourself with just the people that you love to spend time with, and don't worry about the people that you don't, right? Like my wife and I, we hang out with our really good friends, and we don't have a lot of extra time to hang out with people that, we don't enjoy being around. So, I think if you surround yourself with people you love, you make a good decision on what you want to do for most of the hours during your waking day, then it's a life of happiness. That doesn't mean it's not hard, but it's definitely happy.
And so I know we've talked a lot about, I guess, like, the types of people that would make like good doctors, good surgeons, just like in the past.
Mm-hmm.
So what do you think makes a good med student or a good doctor versus a good surgeon?
So we can start with, what makes a good student. And I think, I think the best students have a lot of humility, and they also have a great capacity and energy to learn. I think the best students are the ones that are always asking why, right? Like, they're always, not as satisfied with the answer, and so they're diving deeper. Whether that diving deeper is, going home and reading about an experience that day and coming back the next day to clarify, that follow-up, that kind of insatiable need for more information. And in medicine, I think great empathy with people, right? Medicine is a people job, right? Like, every day that, even if I'm just is a powerful word, right? But if I'm taking a child to the operating room for appendicitis, that's usually, that's the first time that kid's ever had surgery. And those are worried parents. And so engaging with those parents, I think good residents, good medical students, good doctors are people that, engage with people and enjoy that, right? So So insatiable kind of need for education, learning, that engagement, and then who needs or who becomes a good surgeon? I think people that are good surgeons are, take all those qualities of a good learner, and then you add in someone who has really good common sense, street smarts. I think, general surgery or surgery is a lot about figuring things out, right? And also being aware of yourself and your surroundings. And a lot of that to me just seems like common sense. It's not formulaic. Sometimes in the operating room or in the trauma bay, you need to be able to lead and control a situation. And a lot of those things, just come down to making common sense decisions about being aware of your surroundings and yourself. So I think somebody that has good street smarts and good common sense and can figure things out are good surgeons. And then people who don't focus on kind of how long they've been at work or what time of day it is or if it's light or dark out. I mean, you go to work and you get the job done. And, sometimes you'll look at your watch and you'll realize it's the next day or it's late at night. But I mean, you're dedicated to the job and you have a skill set that you get to help people. And you really want to appreciate that skill set and lean into that. So those are just a few of the things. Then, of course, if you're good with your hands and you like to improve and always build a skill set. And the thing I liked about surgery was I was trying to think, if you dropped me out of a plane and you take any medical specialty and you drop somebody out of a plane and they had to just show up somewhere, who would be the most useful? And, I was asking myself that when I was a medical student, and it seemed to me that, a general surgeon would probably be the most useful, right? They have a huge skill set that's procedural, so we can get airways, we can get vascular access, we're comfortable in any area of the body. And throughout general surgery training, you do a lot of medicine. When you're in your ICU rotation, you're taking care of a lot of medicine. When you're doing your preoperative evaluation for surgery, you're looking at people with heart failure, with diabetes. You're trying to figure out how to optimize those things so you can do safe operations and have good outcomes. So yeah, I think who makes good learners, who makes good surgeons? I think if you're humble, you have an insatiable need for more knowledge, you like to fix things and have good street smarts about you, good common sense, and then you like to engage with people. I think those things are probably just, a few check boxes, but they're the ones that resonate with me.
Okay, yeah, no, perfect. Thank you so much. Obviously you've told a bunch of great stories as well as just a lot of insight into surgery and medicine as a whole. I just want to say thank you for your time.
Oh, you're welcome. You're welcome.
And okay, so that was definitely a long one, but I really hope you guys learned something or took away something, whether it be about pediatric surgery, about being a good student, or just trying to maintain a healthy, balanced lifestyle. So yeah, if you guys liked the video, then drop a like, comment below on whatever kind of content you want to see next. I've got a little surprise coming up, hopefully, because I'm going to be I have a meeting with an OBGYN today. He's from England, Dr. Neil Ryan. He's from Bristol, and he's a gynecological oncologist, I think. So he's an OBGYN that also specializes in cancer and cancer resection. So I'm going to be talking to him later today, and hopefully I can coax him into doing an interview as well. And also I'm thinking of trying to do something like a Vogue 73 questions type of thing. So yeah, let's see how that goes. And again, thank you guys for watching. Subscribe, like, comment below, follow the socials, and we'll go from there. All right, peace.